Well, thank you so much, Mark, for inviting me to be on the panel. And I feel like I'm in a room of friends who all understand the population that we're dealing with, so really appreciate it. My name is Laura Golino de Lovato. I'm the Executive Director of Northwest Pilot Project. We're an organization that has been around 54 years, so we're a few years apart, but lots of history here in all of our organizations and the service that we provide. And what we do is we help extremely low-income older adults, and these are folks that are have an annual income of perhaps $26,000 per year. And we help them find rental housing that they can afford and that is safe and decent for them. And as you can imagine, that is a real challenge. So I think that is really at the top of my list for the challenge that we see is providing that access to housing that's affordable. And that's the very first barrier, first challenge, is ensuring that we have enough resources to provide supplemental rent assistance to the people that we work with, and we call them clients, because we really, they are the people that we serve. So we provide rent assistance to them to help them buy down the rent. Or we provide them with access to subsidized buildings, so where the rent is already discounted. But more than that, we help our clients navigate what is often a large lift for them, and that is just navigating the application system of applying for housing, being rejected because you have an eviction on your history, or you have a criminal conviction from 20 years ago, or you have debt, or you have poor credit. None of these things should be preventing somebody from getting into housing, but in today's housing market in Portland, and we work exclusively in Multnomah County, those things do every day prevent someone from getting into housing. So our big challenges are really getting that housing access, and we address those challenges with a financial resource that is rent assistance and with strong case management that works side by side with our clients to address those many barriers and work with them and the landlord or property owner to break down those barriers and allow that person to actually get a lease and rent an apartment and move in.
Betty, how about from your perspective?
Oh dear, I was thinking, this is gonna be so hard to not cry. Thank all of you for being here, and thank you for caring for people. I just think it's so neat that all of us are here and you're caring for people, and I love, Mark, what you're doing to try to stop people who've worked all their lives and did their best and find themselves in situations they never planned on being in. And so, like Mark says, I am a nurse, been a nurse forever, and I worked hospice for a long time, so I saw the sadness of people, dying in situations that were just awful. And so I think that one of the biggest challenges we have is to ensure that the elder adults that come to our pantry have, healthy food. Healthy food is something that we all should have access to. Healthy foods that can ensure your diabetes stays under control. Do you understand what I mean? When you think about this is my thing, when you think about the diagnosis that elder adults are having to deal with, how are they ever going to deal with it and come out good if they don't have healthy food to eat? And so I think that one of the biggest challenges that we face is to ensure that every single elder adult that comes into our facilities able to get those foods that will keep their diagnosis in check. That's a big deal. But also, and we learned this from Store to Door, and so we're forever grateful for Store to Door because they opened the door for us to dip our toes into delivery. Delivery, we were used to people just coming to us. It's a lot easier when you come to us. But then working with Cassie and what they do, and we thought, and Cassie, most of you know Cassie, kind of helped us put in place being able to deliver to people because not everybody can get up and come to us. And so that has been through an amazing grant that we got from Trillium. We've been able to service so many disabled individuals, young individuals, but also the elder adults who can't get out. And what Store to Door taught us is that you're not only giving food to people, but you're touching people. You're giving them, you're making them understand that they're still important, that they're still valuable. And that is our biggest challenge. We need drivers, we need drivers, that's all. We need drivers. Volunteer drivers is all that we need, because then we can get the food, the healthy food to people what they need. But that's, I think our biggest challenge is that we refuse to just give people canned food or stuff that is going to continue to drive up your blood sugar and make your veins get harder. That's us.
Go there, no.
Thanks, Mark. So I'm Pam Miner. I'm the Chief Medical Officer at House Call Providers, and we've been around almost as long as Door to Door. We're approaching 30 years of providing primary medical care, primary care to homebound seniors and those with disabilities. We actually serve clients age 18 to 104. And we are really proud of the team-based care that we've been able to build over these 30 years with the support of the community, including the Fred Meyer Foundation and others. I think in our team-based care model, what is at the center of that model is building a medical plan, a care plan, a way to manage not only diseases and chronic illnesses that folks are challenged with, but also just managing life in general. And we really want to build that with them at the center. So we recognize that there are lots of barriers, but we need to build something that works for them and for their families. And that's one of the places that I see an impact every day, is people feeling like they're really heard, people feeling like they can ask questions and really get to the heart of what quality of life means for them in building their medical care. I think the challenge is in that, we know that just to step back, we are not only a primary care service, but 15 years ago we started a hospice, and we also have a palliative care program that supports Medicaid members who need extra support facing life-threatening illness. And we recognize that it is important to have that whole arc to be able to support people through all of the challenges that they may face. We know from the palliative care literature that when you ask someone about quality of life, they will tell you the most important thing to them is independence. At least that's true for Americans. And so independence, and I would say self-determination, are really some of the most important things, more than pain control or other things that you might think about for someone where you're asking them what's important to quality of life. So we see that in order for folks to maintain that independence, they need access to all the services represented here at this table. They need access to health care, because getting into a clinic can be so draining for some folks, and so to have us come to them is really critical. And for our teams to be able to go to them means we really see what the community is around them. We see the door-to-door volunteers as they show up, and we see the family members and the caregivers who've devoted their careers to supporting people, and that's really exciting. But we also see the gaps, and sometimes it's overwhelming when you walk into a house. And that's really why we believe that we have to build a medical team that's not just about nurse practitioners and physicians or physician assistants, but also includes social workers, nurses, pharmacists, and even a chaplain to really try to fully support them. So as I think about the challenges then for these folks who we manage, who have challenges with their activities of daily living, maybe dressing, maybe bathing, in addition to med management, getting out for shopping, et cetera, we see that they need a place to live that's safe and has access to these additional services that might help them in caregiving. Those are the big challenges. And so we would love to see more low-income housing access and ability that also brings people together in a way that they can share caregiving, that they can afford to pay caregivers because they don't have to bring them in for 6 hours or 4 hours minimum. They could bring them in for a couple hours and really share that service. And I think there are some good examples of that in the community that we could use to move forward in that space. And then caregiving, right? This is the finding those jewels, like all of you, who want to be out in the community, who want to honor our seniors, who want to learn from their experience, and want to make this their career, or finding ways to support them with education, finding ways to encourage people into these fields of caregiving. That's been a particular struggle for us, especially since the pandemic hit, and we see that as a really significant need.
And Jen?
Thank you. My name is Jen Darney, and I am chair of the board of directors of Villages Northwest. We're kind of the newbie in this room. The whole movement, the whole village movement started in Boston in the early 2000, about 2005. We've been forming villages since with wonderful Mary Bedard and I helped open the first village in the Portland metro area. It's an all-volunteer organization to help seniors age in place. As Pam said, most seniors want to remain at home and want to remain independent as long as they possibly can. The village model helps older adults age in place of their choosing, connected to their community and to the supports that are there. Because I offered to unpack the boxes in the office at Eastside Village, which was our first one, I naturally became the volunteer office manager and have continued to help both in my own village and at the larger level with Villages Northwest. It's an umbrella organization. We now have 9 villages in the Portland metro area and another one at the coast in Manzanita, with 3 more in development. Each village operates quite autonomously under the umbrella of the 501c3 that is Villages Northwest. We're community-based, we're nonprofit. Our volunteers are trained as volunteers, but they're not technical volunteers, if you will. They do the kinds of things that folks have trouble doing in their homes. They change light bulbs that are up too high. They get on the ladder because this person's not on the ladder anymore. Transportation is our largest resource, and more than half of our volunteer services are transportation, so that people can get to medical appointments, so they can go to volunteer activities that they do, so they can go to social events. But as you heard from the whole panel, the really crucial thing is the social part. It's connection, and it's connecting to other people in their neighborhoods, and with all kinds of activities that the members design. And so in our village, for example, we have language groups, we have lots of card-playing groups playing games I've never heard of. We have a current events group, we have a gardening group. Anything that the members want to do, then we help them design that as an activity and open it up to the other members. Villages Northwest as a whole also offers educational and social activities for all the villages. And for example, on July 25th, we're working with Laura and about housing options for our members. So those things are done at the larger level. A third of our members are also volunteers. And in 2023, the combined villages, the Villages Northwest, we had 660 volunteers serving almost 740 members with over 5,000 services, half of which were transportation. Our motto is, we're not a place, which is confusing when you call yourself a village. We're not a place, but we're a plan for aging in place. I would say that the way that we are most frustrated now and needing help is, again, what you hear from all of the panel, and that is how to connect our members to services that we do not provide. Because we don't provide medical care, we don't provide medical services. And so how do we help our members understand the options that are available to them in the community? How do we navigate the, maybe you call it a web, I call it a tangle of services that are available, particularly in Multnomah County. How do we help our members navigate that?
So the natural follow-up question is, we talk about challenges, but all of you see things that are working, some from okay well to very well. So why don't we turn our attention to say, what are some of the things that you see that are working well in your slice of the universe? Let's go backwards and start with you.
Okay. Thank you. Well, I think our social activities, I have to say, are working extremely well. We all use a platform that's designed for villages that helps people make requests and helps us fulfill those requests and so on. As part of it, it has what's called a forum where any member can say, does anybody want to go to the Lilac Garden next Tuesday? So that they're connecting to each other. And I think that's the big success, and that explains the growth of our villages in this short time, that it's the socializing and it's the connections that they make to each other. It's meeting people in their neighborhood they didn't know, and so then they can call on them, or they can, say, let's go for a walk or whatever, so that folks are not at home in isolation. Oh, you remember the order.
For us, as I said, I think our team-based care model is really the secret sauce for our organization in terms of being able to really think about all of the needs and how to serve someone holistically. I'm really proud of the fact that our federal government, through CMS, is requiring us to start to ask the questions, all of the healthcare providers out there, to ask the questions about social determinants of health and what is at the core of that Maslow's hierarchy, of needs that need to be addressed. And by doing that, we're going to get data about what those needs are, and we're going to have that to help drive the policy decisions that are going to come in the future. So I see that as a great step forward to include that in the expectations of the medical system, to think about this holistically, because I'm really excited about what I learned tonight from Betty's team about what they're trying to do to think about how does nutrition support smoking cessation, right? Like, that's an exciting idea and an exciting plan. So I see those as successes. The reality is that when we do those surveys of social determinants, transportation and housing are what come up right now. And the transportation area did take a hit. It's been a big challenge for us to get people out to the specialty care and the studies and the things they need for their health. And thankfully, I'm seeing that starting to make recovery. And I know Care Oregon has really made this a focus for the coming year in terms of trying to think about how they can support the non-emergency medical transport that's out there and available to low-income seniors. So as our parent organization, I'm really proud of the work they're doing as well. I think that the other space that I'm excited for is, and that we recognize as an area of need, is mental health services, behavioral health services. And while there are, again, things that have come out of the pandemic that have caused us to rethink how we do medicine, and it's been a good thing, there's just a need for providers that still exists. And so we took the step forward to add to our team of social workers and nurses and care coordinators who help you navigate the system. We've added behavioral health counselors that can do both telehealth and home visits to our clients because we see that need of trying to support more staff in this space. So those are our success stories.
What's working really well? I could tell you so many stories. And one of them is, if you guys go back to our table, we have a table back there. We have a huge immigrant population, and a neat thing about serving a lot of immigrants is that you just see the whole world come through your pantry, at night, and it's a lot of fun. And so we decided to do a cooking class, for that would highlight. I'm from Costa Rica originally, and so when you're from Costa Rica, you honor and love your grandparents a lot. You better, or you'll hear about it. And so we're doing this cooking class to honor the immigrant families that come to our pantry. And so we started started in January. So we blasted this email that says, okay, we want you guys to send us the most loved recipe of your family of origin. And so you have this daughter who's talking about her grandma and learning this recipe from their grandmother and literally honoring. I think one of the things that you said that I loved is that people just I think the elderly want to know they're still significant. Yeah, my pain is bad and things are bad, but do I still, does my existence really mean anything to anyone? And so these cooking classes are basically giving room for the younger generation to talk about the amazing things they've learned from their grandmother and their grandfather, and they're just taking that all, and they're very proud to tell us about it. And we are very humbled to teach all our other ethnicities how to make this recipe, and it's taken off like a rocket. Our classes are way too big. People are, Mexicanos are learning how to make things that African American love. And so that's something that's working really great. And the second thing that's working really good is our delivery program, because word of mouth, just people calling, hey, I hear you're delivering food to, mother such and such. Can I get food also? And so we find that the connectivity that people have, and it's just lovely between each other. And so therefore, one of the things that have really helped our delivery program work is neighbors talking to neighbors, and basically neighbors taking care of neighbors. And so the elderly in our community, their neighbors are saying, hey, I was bringing milk to whoever, but can you guys really deliver food to her, because she can't do this and she can't do that. So our delivery program is working really well to help seniors that just aren't connected. I think when I was in Rapid, I was telling part of one of your physicians back there that when I was in Rapid City, South Dakota, and I worked hospice, and I don't know how many of you guys have been to Rapid City, South Dakota. I just happened to be there because my husband took me there. And so I had to go. And so South Dakota. And so, but when I was there, I found that it was the saddest thing, because I did hospice, so I did a lot of hospice in the nursing homes, and you had all these elder people dying alone. And they loved Rapid City, and they're going to go to California with their crazy daughter and to Portland with their crazy son. They wanted to stay in Rapid City. And so you had all these elderly people dying alone. And I thought, is there anything sadder than this? I believe that what is happening here with this group, and hopefully what's happening in different parts of the city, is that people are wanting to step in and take care of people. That's what we're seeing with our delivery program, that neighbors who have been kind of trying to take care of neighbors are calling about their neighbors and see if they would qualify for our program. So I've loved that.
That's awesome.
Yeah.
Yeah. So I think for us, what is working really well is our grit and determination as an organization to get people into housing. And every time we place someone into housing, it's a success, it's a celebration, because that gives that person a home of their own, where they can heal, where they can get access to medical care, where they can cook food,
Yeah.
where they can think about the social connections. All of that is really almost impossible to do if you're living in your car or living in a tent. And in the same vein, we feel success when we've helped prevent someone from getting evicted, because we could come in with some caregiving assistance to clean their unit, which, believe it or not, if your unit is not well maintained and you're in subsidized housing, you could get evicted just for that. Yes, it's true. And so that's one of the things that we feel really good about. And I just want to give a shout out, because my friend Sean is here. Thank you, Care Oregon, for a significant gift to Pilot Project to help us with eviction prevention strategies. Because every time we stabilize the housing of someone, we are doing the most upstream solution to homelessness. We're preventing it in the
Yeah.
first place. And all of these housing placements that we do, we celebrate with our clients, and we know that that's the first step to, or one step in the social determinants of health. That really is big, and even though it's hard, and there are lots of challenges along the way, it really feels good.
Thank you. If for those who know Store to Door, you can hear some of the themes of all of these organizations, because we're learning from them and they're learning from us, and it's a wonderful reciprocal relationship. And I couldn't imagine a panel nailing the things that we need to hear over and over again. The importance of social connectivity, the importance of working together, the importance of keeping people stabilized in their homes. That's huge, and we are finding ourselves drawn more and more into that work of helping to keep people stabilized by bringing other resources to the table, and I think that's really important. So last question I want to ask is, all these guys, I mentioned that they're policymakers, because they are. I mean, we have financial institutions in this room, we have funders in this room, we have policymakers in this room, we have people with deep pocketbooks in this room. We have lots of decision makers. So if you were to say, okay, I have a platform here to say, what is it that needs to happen next? What would be 2 or 3 things that need to happen next from your perspective in terms of stabilizing and supporting the seniors that we all collectively serve? And I will just hand it to Jen and ask you to...
No, I'm not going to start.
Oh, she's not going to start.
Well, I will dive right in, because I think about this every day. And I will say that Northwest Pilot Project, I've been describing us as rent assistance evangelists, because rent assistance is one of the fastest ways to stabilize someone in rental housing when they are low income and there aren't enough subsidized units. So more rent assistance, please. We would love to see at the state level, because we are fortunate in Multnomah, Washington, and Clackamas counties to have a regional rent assistance program that is paid for through the Supportive Housing Services tax measure, which has been amazing. But we need to see rent assistance at the state level. And we would love to see the U.S. Department of Housing and Urban Development be funded to provide more of the housing choice vouchers, which are the federal level rent assistance vouchers that allow people to say, I don't want to live in that building. I want to live over here in my community, and then be able to have affordable housing in their community. 2 other really quick things, because I could go on forever, are addressing the imbalance of power in access to rental housing, with the property owner manager controlling screening criteria that disproportionately affects of people of color, low-income people, families with children, and people with disabilities. We've got to do something to streamline access to rental housing so that a criminal conviction from even 2 years ago or a poor credit score doesn't prevent you from getting into housing. And then we've got to figure out a way to build the pathway for people who want to become caregivers and give them better working conditions, better money, and a career pathway. So those are three things that are on our mind.
Wow. That is such a good idea. That's great. You know, mine is simple. I don't want to, I just want all the money I can get to buy all the food. I just don't, I think everybody should be able to eat. I mean, I'm doing my best not to cry right now, but I think food, everyone should have access to food. I can't even imagine why that's an issue. I can't imagine why pantries have to hopefully things will happen, that we will get the money, that we will get some milk. Yeah, I think that if people are willing to get up and get food off of trucks and pack up so that people can walk through and get their food, what is complicated about that they would be given the finances that they need to do that every single day? Why would that be such a hard ask of funders? So that's what I think. I think a lot of the reason people say, Betty, why do you have people coming once a week? Why do they come so often? You know why they come so often? Because if they can come that often, they can pay their rent.
Yeah,
Literally, that's one of the
yeah.
reasons. If they can come that often, they can pay their electric bill. Hallelujah. If they can come that often, a lot of the things that keep them in their homes, bottom line is why we do once a week. No other reason. Yeah.
Are you ready?
So the thing that I've been thinking about lately that we most could need is, and several of you are familiar with it, but the idea of a navigator who can help our members access services and find out what they are at least. And we don't have any paid staff, and so that would be our first, and it would be, I think, a really useful thing for our members.
Thanks. Well, you all have been very eloquent, so I'm trying to think about what I can say that's different. One of the things that I've appreciated is that there has been an effort to create a central location to help connect all of these agencies and to help people find what they're looking for. It's called Unitas. And I just want to say that what I hear is that we need to get into the 2.0. We need to go from building the structure and getting people enrolled in it to really understanding how to make it work.
Yeah.
And we need some, we're at that stage where we're all begging for that. And so I hope that the folks who are involved in that will continue to work on asking, how do we make that really work so that we can build the community that we're looking for to support our members in our community to the fullest. I think from a healthcare lens, as I said, the pandemics are disruptors, right? And so one of the things that it's done is it's created a better acceptance of telemedicine across the country. And I think that that's going to serve our elders and it's going to serve our younger population, and we have to embrace it and we have to continue to reimburse for it and make that work. But it's not going to work for everyone. And so practices like ours who can bring providers to patients' homes to support their health and longevity and functional status and all of that is going to be important. And I've just, again, appreciated how Oregon has been at the front of trying to think about that creatively in supporting its seniors. Senator Wyden has been at the front of that. And I'm seeing a lot of exciting models that are coming out of the work that he supported to try to pilot these ideas. And the one thing that I want to just do to make sure that we don't lose the strength of that is to remember that it was practices like house call providers small practices who believed in the mission and believed in the importance of this, that have been working hard and trying to survive, but they open and close across the country all the time. And so we need models out of CMS that don't require 10,000, 20,000, 100,000 patients. We need models that can allow small practices in rural communities and other spaces to participate as well. And that probably means we have to band together, but we need support in finding each other and ways to band together, because I do believe that in-home medical care is going to be critical to our success going forward. So thank you, and thanks for pulling this all together, Mark.
So even though I'm not on the panel, I get to answer this question too, because I'm holding the mic. I think that there's two other things that I would want to share. And I was cautioned actually to tread lightly on the first one, which is the fact that we are building affordable housing, and we need to continue to invest in building affordable housing. But if you look at a typical affordable housing build out, we're talking about several $100,000 per unit. And building our way out of the crisis we're in is not sustainable. I'm not saying we can't do it. We have to think about different models of how do we get access to affordable housing. That's one thing we need to continue to invest in. We need to rethink some of the ways that we do it. I also think that we need to back our lens up and look at this panel right here and include us on that panel, and we become a network that is working on the prevention side. We're working on trying to keep people in their homes when, like I mentioned earlier, their home might be their only asset and it's deteriorating because their physical strength is decreasing. So we need investments on the front end, on the prevention end, so that we're not all scrambling to say, how do I get enough money to have enough food on the shelf in the food pantry? And how do I get 2 more people in homes? Or how do I find a care navigator when we're an all-volunteer organization? It really is going to be about how do we, as a community, start thinking about investing largely in the system that's going to support seniors in their homes. And so that would be my wish, that would be my ask of policymakers, of all you in this room, to start thinking about how is it that we can start changing the way we invest, change the way the incentives work so that it benefits those of us who are struggling day by day in the field to keep our doors open and to continue to expand and meet the overwhelming needs that are around us.